Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common and controversial medical complaints of childhood. Some studies indicate that nearly 10% of school-age children are affected. ADHD causes a combination of inattention, impulsivity, and hyperactivity. While these symptoms may be part of normal childhood development, children with ADHD develop difficulty completing normal daily tasks due to this disorder. So what causes ADHD? Well, the cause is unknown, but there seems to be an imbalance of chemicals in the brain. But it is unknown if the problem relates to an over or underproduction of these chemicals, or perhaps to an abnormal response to these chemicals in the brain. Subtle differences in brain anatomy have been detected in children with ADHD. However, the significance of this is unknown. So what exactly is inattention? Well, inattention is distraction while performing work, losing, misplacing, or forgetting objects, disorganization, daydreaming, or poor school performance. So what exactly is impulsivity? Ooh, a butterfly. So what exactly is impulsivity? Risk-taking behavior such as riding a bicycle over a ledge or into the street, yelling out answers to questions too quickly, accidentally injuring other children, impatience, especially while waiting in line. So, what is hyperactivity? Excessive movement, talking or fidgeting, inability to sit still, difficulty playing quietly, poor behavior, anything like that. There's like a list of things that goes on forever. So how is ADHD diagnosed? Well, there is no medical test for ADHD. The story provided by the family, school, or caregiver is usually enough to make the diagnosis. Surveys and questionnaires are often helpful, but ADHD must meet the following criteria. It must be present in more than one setting, for example, at school, home, and church. It must be present for 6 months or more, must occur before 7 years of age, must be excessive compared to normal childhood behavior, must affect school, home, or social activity. Other disorders should be excluded by your doctor. So how is ADHD treated? Well, behavior therapy and educational interventions may be helpful. Some examples include frequent progress reports from school, sitting close to the teacher, removing distractions, private tutoring, and others. So stimulant medicines may be used in children 3 years of age or older. They are in a class of amphetamine-like drugs that stimulate nerve activity in the brain. While providing stimulation to a hyperactive child may seem counterproductive, these medicines actually help children focus. The effect is somewhat like an adult drinking a cup of coffee for the caffeine to wake up or concentrate better. Some examples of ADHD stimulant medicines include Adderall, Concerta, Focalin, Metadate, Ritalin, Vyvanse. Strattera is a non-stimulant medication that works in some kids. So what are the most common side effects of the stimulant ADHD medications? Poor appetite and weight loss, sleep problems, restlessness or irritability, headache, abdominal pain, or diarrhea. So is this really ADHD or just a spirited child? ADHD is probably overdiagnosed and overtreated. Active children become active adults, and active adults become doctors, lawyers, politicians, and business leaders. So ADHD treatment should begin only after a careful discussion with your doctor. This has been Dr. Michael Davis. For more information on this and other kids' health topics, please visit our website, healthykidtips.com.